how does this myeloma affect the body and why it is often diagnosed late?
As I said, the presenting symptoms are very faint. If we're talking about a tumor, some other type of tumor, patient will say, I have a big mass over here, my appetite is reduced significantly, I have lost weight significantly, I've had a lot of fevers. So myeloma doesn't have any of these overt symptoms. It only presents with mild fatigue that usually builds up over a period of time, non-specific bony pains or body pains here and there, or mild abnormalities in the kidney functions with anemia, that is low hemoglobin. So unless you have the hunch or the high suspicion that is required to look for and diagnose myeloma, it actually is a diagnosis that may be missed.
Doctor, what are the diagnoses of myeloma?
So the diagnosis of myeloma actually goes by a very popular mnemonic called CRAB. So that means there is increased calcium levels, there is kidney dysfunction or renal dysfunction, there is anemia, and there are bony lesions. So these are the four main things that we look for when we are suspecting a patient with myeloma. So usually it starts with blood tests where we get a complete blood count to look if there is any low hemoglobin or anemia. We test the calcium levels for the patient. We also look for kidney dysfunction or abnormal creatinine, and we do imaging called PET-CT. Previously we used to do what is called skeletal survey, but nowadays we do what is called TG Avid PET-CT or whole body PET-CT, because we're looking for these punched out lytic lesions in the bones. Apart from this, when we get a suspicion that there is myeloma based on any one of these parameters or based on the patient's symptoms, we ask for a specific tests of sets, all blood tests and urine tests, to look for these protein quantities. So they are called serum protein electrophoresis, protein immunofixation, and about another 4 or 5 tests which all look for these protein abnormalities both in the blood and the urine. And last but not the least by any angle is a very important test called bone marrow aspiration biopsy. As I mentioned, myeloma is a type of blood cancer, so it originates or starts off in the bone marrow, which is a factory where blood cells are made. So we take a small sample from the hip bone usually and we send it for testing, where we are looking for increased number or percentage of plasma cells, and that usually clinches the diagnosis.
There have been existing advancement in cancer treatment recently. What is the treatment or breakthrough or happened in myeloma research?
That's an excellent question. So myeloma has been long-standing disease. Despite that, we haven't found a cure as in a long-lasting cure. Most myeloma patients, depending on their age and their risk criteria, we decide whether they require transplant or would they qualify for a what we call autologous stem cell transplant. So the goal for a myeloma patient is to keep their disease in remission. To say we can 100% cure it is going to be a little bit of a far stretch. All the time we are going for cure, but there is always a slight risk of the myeloma coming back. So what do we do for treatment? We give induction regimen. So we can't really call it chemotherapy because it mostly involves targeted therapy, involves steroids, which is a type of immunotherapy, and immunomodulator. So basically we sort of moderate or modulate your immune system so that the myeloma sort of calms down. So following this combination of immunotherapy and immunomodulator therapy, we then try to bring the disease to remission and do autologous stem cell transplant in all patients below the age of 65 or in fit patients if the individual can tolerate up until the age of 70 years old. Beyond the age of 70, it is very difficult for patients to tolerate this slightly aggressive treatment called autologous stem cell transplant. So what is the new research or what is the new data for treating patients with myeloma? In patients who have undergone induction treatment with chemotherapy and have also undergone transplant already, if they have again relapsed with myeloma, then there is this treatment called CAR T cell therapy or chimeric antigen T cell receptor therapy. So it's called CAR T in short form, T cell chimeric antigen receptor, where the patient's immune system itself is modified significantly. So these T cells can go hunt these myeloma cells and actually destroy them. So autologous stem cell transplant is where we are trying to rewire the bone marrow of the patient so that these plasma cells are not formed. But CAR T cell therapy is a treatment where we are trying to awaken or keep the patient's immune system so active that the moment these plasma cells are made by the bone marrow, these T cells, the modified T cells, go in search of them, hunt them down and destroy them. So CAR T cell therapy is one of the most advanced treatments that's available for multiple myeloma at this moment. CAR T cell therapy for myeloma in India is not yet 100% approved. It is still in the experimental stages, but we are looking at the next few months where CAR T cell therapy is going to be approved. It is now being used widely in the West for what we call relapsed refractory multiple myeloma.